100 MCQs with answers on topic, Biopharmaceutics, in subject Pharmaceutics. We are sharing questions and the direct answers to save your time. General syllabus has been given in our video, A1, uploaded at our YouTube channel, Pharmacy Jobs and MCQs. Biopharmaceutics. 1. The rate-limiting step in drug absorption for poorly soluble drugs is. Answer. Dissolution rate. 2. The main site of drug absorption in the GI tract is. Answer. Small intestine. 3. The extent to which a drug is absorbed and reaches systemic circulation is called. Answer. Bioavailability. 4. The process of drug movement from the site of administration to systemic circulation is. Answer. Absorption. 5. The volume in which the drug would need to be uniformly distributed to produce the observed blood concentration is. Answer. Volume of distribution. 6. The fraction of an administered drug that reaches the systemic circulation unchanged is. Answer. Bioavailability. 7. The primary mechanism for drug absorption in the gastrointestinal tract is. Answer. Passive diffusion. 8. A drug that undergoes extensive first-pass metabolism will have. Answer. Low bioavailability. 9. The rate at which a drug is removed from the body is described by. Answer. Clearance. 10. The time required for the concentration of the drug in the blood to be reduced by half is. Answer. Half-life. 11. The major route of drug elimination is via. Answer. Kidneys. 12. The process by which a drug is chemically altered in the body is called. Answer. Metabolism. 13. The primary organ for drug metabolism is. Answer. Liver. 14. Drugs that are weak acids are better absorbed in the. Answer. Stomach. 15. The process by which drugs are absorbed through cell membranes using energy is called. Answer. Active transport. 16. The steady-state concentration of a drug is achieved after approximately how many half-lives? Answer. 4 to 5 half-lives. 17. The drug transport protein primarily responsible for drug efflux from cells is. Answer. P-glycoprotein. 18. The study of drug absorption, distribution, metabolism, and excretion is called. Answer. Pharmacokinetics. 19. The phase of pharmacokinetics involving drug distribution is. Answer. Distribution. 20. Drugs bound to plasma proteins are. Answer. Pharmacologically inactive. 21. The parameter that describes the speed of drug absorption is. Answer. Absorption rate constant. 22. Drug distribution depends on. Answer. Blood flow. 23. The bioavailability of an intravenous IV drug is. Answer. 100%. 24. The area under the plasma concentration time curve AUC represents. Answer. Extent of drug exposure. 25. The equation describing drug elimination from the body is. Answer. First-order kinetics. 26. The primary method of drug excretion from the body is via. Answer. Renal excretion. 27. Drugs that are lipophilic tend to accumulate in. Answer. Fat tissue. 28. The fraction of a drug dose removed per unit of time is defined as. Answer. Clearance. 29. The rate of drug elimination is directly proportional to the drug concentration in. Answer. First-order kinetics. 30. In zero-order kinetics, the rate of drug elimination. Answer. As constant. 31. A drug with a narrow therapeutic index requires. Answer. Close monitoring. 32. For drugs metabolized by the liver, a high hepatic extraction ratio indicates. Answer. Extensive first-pass metabolism. 33. The maximum concentration of a drug achieved in the bloodstream after administration is called. Answer. Cmax. 34. The time at which the maximum drug concentration occurs is called. Answer. Tmax. 35. A drug with a high volume of distribution is likely to. Answer. Be distributed extensively into tissues. 36. Enterohepatic circulation refers to. Answer. Recycling of drugs between the liver and intestine. 37. A drug is considered bioequivalent when it has the same. Answer. Bioavailability. 38. The therapeutic window refers to. Answer. The range between the minimum effective and toxic concentration. 39. A prodrug is. Answer. A drug that is metabolized into an active form. 40. Factors affecting drug bioavailability include. Answer. Solubility, stability, and first-pass metabolism. 41. Sublingual administration bypasses. Answer. First-pass metabolism. 42. Oral bioavailability is influenced by. Answer. First-pass effect. 43. Parenteral routes of drug administration include. Answer. Intravenous and intramuscular. 44. For sustained release formulations, drug release is controlled by. Answer. Diffusion and dissolution mechanisms. 45. Lipid-soluble drugs are more likely to cross. Answer. Cell membranes. 46. The therapeutic index is calculated as the ratio of. Answer. Toxic dose to effective dose. 47. The fraction of the drug that is excreted unchanged in urine is dependent on. Answer. Renal clearance. 48. The rate-limiting step in the absorption of highly water-soluble drugs is. Answer. Membrane permeability. 49. Protein binding of drugs is important for. Answer. Drug distribution and elimination. 50. A drug's bioavailability can be increased by. Answer. Reducing first-pass metabolism. 51. First-pass metabolism occurs in the. Answer. Liver. 52. The blood-brain barrier restricts the passage of. Answer. Large and polar molecules. 53. A drug with a low therapeutic index is. Answer. More likely to cause toxicity. 54. Bioavailability of a drug can be influenced by. Answer. Food intake. 55. In facilitated diffusion, drugs move. Answer. Down their concentration gradient. 56. Drugs administered intramuscularly are absorbed. Answer. Into systemic circulation via blood vessels. 57. Weak base drugs are better absorbed in. Answer. The intestine. 58. Ionization of drugs affects. Answer. Their ability to cross biological membranes. 59. Bioequivalence studies compare. Answer. The rate and extent of absorption of two drugs. 60. The elimination half-life is influenced by. Answer. Clearance and volume of distribution. 61. The liver enzyme system primarily responsible for drug metabolism is. Answer. Cytochrome P450. 62. A high extraction ratio indicates that the drug. Answer. Undergoes extensive first-pass metabolism. 63. Drugs that are extensively bound to plasma proteins have. Answer. Low free drug concentration. 64. An increase in renal clearance will. Answer. Decrease plasma drug concentration. 65. Drugs eliminated by the kidney undergo. Answer. Filtration, secretion, and reabsorption. 66. The steady state concentration of a drug is directly related to. Answer. The infusion rate. 67. Oral drugs must survive passage through the. Answer. Stomach acid and liver metabolism. 68. The pKa of a drug influences its. Answer. Degree of ionization in different body compartments. 69. The area under the curve AUC measures. Answer. Total drug exposure over time. 70. The process of drug removal from the body is called. Answer. Elimination. 71. Volume of distribution depends on. Answer. Tissue binding and plasma protein binding. 72. The bioavailability of drugs can be reduced by. Answer. First pass hepatic metabolism. 73. The primary route of excretion for water-soluble drugs is. Answer. Renal excretion. 74. Passive diffusion of drugs across membranes depends on. Answer. Lipid solubility and concentration gradient. 75. Drug absorption from the GI tract is faster when. Answer. The drug is non-ionized. 76. Drugs with high protein binding have. Answer. Low clearance rates. 77. Drug bioavailability can be increased by. Answer. Avoiding first pass metabolism. 78. A drug's therapeutic range is the range of. Answer. Drug concentrations that elicit therapeutic effects without toxicity. 79. Enzyme induction results in. Answer. Increased drug metabolism. 80. The elimination rate constant K represents. Answer. The rate at which a drug is removed from the body. 81. Renal excretion is influenced by. Answer. Glomerular filtration rate. 82. Intravenous IV administration of drugs bypasses. Answer. Absorption barriers. 83. Drug bioavailability can be affected by. Answer. Gastric emptying time. 84. In drug distribution, the central compartment refers to. Answer. Plasma and well-perfused tissues. 85. A drug's half-life is influenced by. Answer. Both clearance and volume of distribution. 86. Lipophilic drugs tend to. Answer. Cross cell membranes easily. 87. Drugs with extensive first-pass metabolism are often. Answer. Ineffective when administered orally. 88. A drug's absorption rate is primarily determined by. Answer. Its solubility and dissolution rate. 89. Drugs eliminated by zero-order kinetics are. Answer. Cleared at a constant rate regardless of concentration. 90. The drug plasma concentration at which half the maximum response is achieved is. Answer. EC50. 91. Drug accumulation occurs when. Answer. Dosing interval is shorter than the elimination half-life. 92. The rate at which a drug is absorbed is affected by. Answer. Its formulation and route of administration. 93. The bioavailability of a drug is least affected by. Answer. Molecular weight. 94. Which route of administration provides the highest bioavailability? Answer: intravenous. 95. The primary barrier to drug absorption through the skin is. Answer: stratum corneum. 96. In pharmacokinetics, the term first pass effect refers to the metabolism of a drug by the. Answer: liver. 97. A drug that exhibits nonlinear pharmacokinetics will have. Answer: dose-dependent clearance. 98. The maximum plasma concentration Cmax of a drug depends on. Answer: the rate and extent of drug absorption. 99. The first order elimination rate constant K is calculated by. Answer: dividing clearance by volume of distribution. 100. Drugs that are highly bound to plasma proteins are likely to have. Answer: a longer duration of action. Regards. To get more, contact us. Majid Body Advocate, LLB, PhD Scholar, Pharmaceutics 2023-2026. Vice President, Pakistan Pharmacist Association PPA Punjab, Pakistan. +92321 4042036. Thank you.